Peter Kariuki has been a cigarette smoker since 1983 when he was in high school. Severally he has tried to stop, but he just can't.
Nimejaribu kuacha ni siku 3. Nikagojeka. Kurudia sigara, nikasikia ugonjwa imekwisha.
Every time he smokes, he has to keep away from his family and children. He doesn't want them to suffer from second-hand smoking. He also says he doesn't want his children to take up the vice.
Hata wakati nafutia hapo, anaona ninawadhuru. Mimi naona ninawadhuru. Natoka kufutia ije ama naenda kwa choo kufutia kwa choo. Ndio si wadhuru. So sigara sio mzuri.
Kariuki says he would be much better in life now. He has TB and has financial troubles which he attributes to his smoking.
Sababu hiyo pesa kama anawekaga ama naweka ningenunua nini? Hata sio bicycle ya kuwa na gari.
He is among those likely to be affected by the new tobacco sale and use regulations published by the Ministry of Health today. The regulations require manufacturers of tobacco products to disclose all the ingredients in their products, the quantity of products sold, their market share and the revenue earned. They are also required to contribute 2% of their earnings to a fund which will be used for more advocacy and counseling services, among others. One of the most radical measures, however, will be the prohibition of the sale of cigarette sticks. Now all cigarettes will be sold in packets. The Tobacco Control Board insists that the regulations are timely.
A country with a sick and dying population is never going to develop, whatever the technology.
However, vendors and users see a fault in some of the regulations. For Kariuki, buying the sticks made him smoke less. The vendors also have their own ideas.
Mimi nanuanga 5, 4 hivi. Nunuagi pakiti mzima. Sababu nikinunua mingi ndio itakunywa sana. Sasa jaribu kujipimia lakini inawezekani.
Ingekuwa mzuri wanafunga kutoka 5, 10, 20 ili waweze kununua.
All these, though, are likely not to be considered with the regulations already published. In any case, the ministry says it is not keen on having any measures that will not lead to a reduction in smoking.
There's a lot of ignorance which the industry exploits. They know the people don't know. And they want to exploit that ignorance to a point where if they got a leeway of this relaxed regulation, then they know they'll sell more. And they'll kill more by that very token.
There will be no smoking in any public place. While some of these rules are already being applied, especially in Nairobi, the designation of some of the public places will catch many by surprise. Smoking is not allowed in discos and entertainment joints, as well as restaurants and bars. But should the owners of such premises wish to allow smoking in their premises, then they should construct smoking zones. The smoking area, according to the law, should be a room that is ventilated such that the air from it doesn't go outside. It should also be separate, enclosed and sealed from the floor to the roof, and the people who do not smoke do not have to enter there for anything while smoking is going on inside. Something more like this, the smoking booth at Ranalo restaurant on Kimathi Street.
Tobacco, with its content, is a sure cause of cancer. What are the contents of tobacco? There are 4,000 chemicals, 400 of which will hurt any human body. Okay? Give nicotine, which is a prominent part of that, to the elephant. 1 gram is enough to kill it.
And the regulations do not stop there. Owners of public premises are required to display signs informing people that they are not allowed to smoke there and that there is a penalty. Vendors are also supposed to display signs warning buyers of the harmful effects of cigarette smoking. They are also supposed to stock only products with pictorial warnings on the packets. All the images to be used by the manufacturers have been provided in the regulations. The regulations will start being implemented on the 26th of September this year, nearly 10 years since the law was passed. The ministry blames the tobacco industry for this delay. Initially, it said it wanted more time, then it took the government to court to challenge the regulations. Andrew Ochieng, NTV.